Sleep is a complex biological process. While we are sleeping, we seem to be unconscious, but our brain and body functions are still active. They will be doing a lot of important jobs to keep us healthy and function at our best the next day. As we age, we lose sleep and it gets less sounder too. When we sleep, the first of the sleeps what we get is called as the non-rapid eye movement sleep, followed by shorter bursts of rapid eye movement sleep. So what are these two? As I said, the first sleep, we technically call it as a non-rapid eye movement sleep, which also has three phases. Each phase could last about 5 to 15 minutes. And we go through all these phases before we reach the REM sleep. That is the rapid eye movement sleep. So we will start with the non-rapid eye movement. So in the stage 1, our eyes are closed, but it is easy to wake us up. You must have noticed something, small disturbance, you wake up. And this lasts 5 to 10 minutes. From this very light sleep, you go to the stage 2 of a lighter sleeper. Our heart rate slows, our body temperature drops. In other words, our body is preparing to get into the deep sleep mode. And this mode can last for about 10 to 25 minutes. And then comes the all-important deep sleep stage, the stage 3 of the non-rapid eye movement sleep. Once we slip into the deep sleep phase, it is harder to be aroused. This is when the body repairs and grows. Immune system also gets developed here and it strengthens. That's why if you don't sleep well, your immunity is also at risk. Then comes the rapid eye movement sleep. As the name suggests, our eyes move rapidly in different directions, but there is no visual information which goes to the brain. So it moves, but it doesn't send discharges or signals to the brain. So the second phase is called the REM sleep or the rapid eye movement sleep. Here in this phase, as the name suggests, our eyes move rapidly in a range of direction, but it doesn't send any visual information to our brain. This generally happens 90 minutes into slipping into sleep. Initial periods last for lesser time for about 10-12 minutes, and as it goes ahead, the duration of REM sleep increases. Dreams definitely happen in this phase, so make sure you get into this phase and dream big. And also it is important for learning process and increasing production of proteins. Generally, babies can spend up to 50% of the sleep in the REM stage, but as we grow older, it can come down to about 20%. So, which are our sleepiest hours? Interesting question. So, generally, time in the noon between 1 to 3, usually post lunch, we call it as we all feel sleepy. And also, very early morning, 2 a.m. to 4 a.m., are the two of the sleepiest hours, so never miss that. Early to bed and early to rise is the key. In fact, Veda says we should wake up by 4 a.m. So, why is it sleep so important? Firstly, it is a function of the brain. It's not that you're not doing anything. It is a function of the brain. It's mandatory for all of us to get adequate sleep. It recharges our mind and body. Growth hormone, we all know, is secreted during the sleep. That's why it becomes more important in kids to sleep well. That's why the nature has provided a way that the kids sleep much more than the adults. Of course, sleep in good quantity and quality is essential for physical, mental, and emotional well-being. It has some functions like consolidation of memory and boosting of immunity. Someone is forgetful, just check with him how good is he sleeping. So usually newborns up to a year or so can sleep up to 14 to 16 hours a day, and with aging this comes down. For example, a toddler can sleep 11 to 14 hours. School going children can sleep 9 to 12 hours. Teenagers and adults around 8 hours. And with aging, it may come down by an hour or so. Important thing about knowing the sleep is when it gets disorganized, what are the problems we face? Sleep disorders. There are 6 important sleep disorders. The commonest of the lot, which of course all of us would have faced sometime or the other, is insomnia, where we are finding it difficult to fall or stay asleep. Sleep apnea, refer to this video link for that. It's an important, most neglected sleep disorder. Sleep apnea, which can be dangerous for the self and also for the others. I always tell people who make sound during sleep are not sound sleepers. So if someone is snoring, it could be a disorder. Hypersomnia, sleeping excess also can be a problem, like in narcolepsy. Circadian rhythm disorders, because the sleep-wake cycle can be disorganized, especially someone working in shifts. Someone also can have parasomnia, means people behave unusual ways while falling asleep, like walking, talking, or eating during sleeps. That's called parasomnia. And another important disorder is the restless leg syndrome, where there's a tingling, pricking sensation around the legs, where people feel like moving their legs all the time during the sleep. So these are the commonest disorders. What generally triggers? Well, firstly, bad habits, stress. Bad habits means you don't maintain timings, irregular schedule of working, sometimes it's not under our control. Of course, presence of other disorders like diabetes, hypertension, some lung nerve disorders also can contribute. Mental illness, depression and anxiety should not be forgotten. Medications are another important causes of the sleep disorder. Caffeine and alcohol are the most common cause of sleep disorder. Exercise, of course, is very good, but if you try and exercise late into the evening, when it's closer to the bedtime, then it can also cause sleep disorder because it releases a lot of hormones making you more active. Physiologically and naturally, as we grow old and age, sleep comes down to an extent. So these are all the common causes of sleep disorders.